All right, Dr. Adami, lots of people wonder about their toothbrushes: electric toothbrush, soft ones, hand ones, tough ones, bristle ones, even the floss, same thing, kind of like they come like as thick as a sailor's rope and as thin as barely can see it with my eyes anymore at this age. So can you tell us about what maybe is good or not, or is there a difference? Is it a matter of what you like? What's the deal?
Well, not really. We often say that you should use only a soft toothbrush. Even a medium or hard over time can be abrasive, and it can wear away the gums and it can wear away the tooth over long periods of time.
So why do they
only recommend.
So why do they make it?
That's a good question. I'm not really sure, and I think now though you see a lot less of them. Most dentists, at least that I know, recommend using only soft brushes. Now you mentioned a power brush. The electric brushes work very well, and they work far better than your manual old-fashioned brush. So we recommend to all our patients that an electric brush is certainly the way to go. It can remove much more plaque, and many of them have some nice features built in that can prevent excessive tooth wear. One of them I know of actually has a sensor. If you push too hard on the tooth, the brush either beeps or it actually shuts off. So there are some good aids in that field.
All right. What about flosses?
Flosses, I tend to advise my patients to use a non-wax floss, a floss that doesn't have any wax, because sometimes that waxy residue can get on the teeth, and you can sometimes have the plaque stick to the wax. So we like to use an unwaxed floss when you can, unless your teeth are very, 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 very tight and you have a hard time getting the unwaxed floss through there. Then it's okay to use the wax floss. But we like an unwaxed. We also like to use a floss that's made of Gore-Tex. It's a very thin, slippery material that doesn't have any wax on it, and is very effective at getting in between tight areas. It doesn't shred like some of the cheaper flosses can. So it's a very good product.
Well, okay. Now, when we brush, are we paying more attention to the actual white part of the teeth, the enamel, or are we paying more attention to the gum, or somewhere in between, or is there some techniques which we should maybe adhere to?
Yes, there is. I always tell my patients to put half the brush on the tooth and half the brush on the gums, and you just kind of want to almost vibrate the brush at a slight angle, and picture the ends of the bristles kind of going down between the gum and the tooth. The area between the gum and the tooth is where most of the problems happen. That's where you get much of your cavities, and that's where you get all of your gum disease. So basically brushing the gums and the tooth is what's recommended.
So it's kind of like with a carpet, you know. If you don't every so often lift it up a little bit and go under the carpet for a few inches, that's where the rotten chicken and the rotten egg will be, and then you wonder where the smell comes from, and that's it, right?
That's a very good analogy, yes.
Okay. Well, all right. Anything else on brushing, flossing we should know, or you think that covers it?
Well, I think that covers it for the most part. Just keep in mind that the goal of brushing is not to get a fresh, minty mouth. That the goal is to remove all of the bacteria, and just picture that you cover every single area of the mouth. Many people don't brush their tongue. You should brush your tongue. I even brush the insides of my cheeks and the roof of your mouth. Any place that food particles can sit and harbor bacteria, you want to brush out. Not just the teeth and gums.
Well, that's interesting. Brushing the tongue and the cheeks makes sense. I mean, obviously, it's rough material, kind of like,
sure.
and stuff can like easily hide there. And I guess brushing it off a little bit, couldn't possibly do any harm.
That's correct. You're right.
Yeah, in fact, I've lived in India a couple of years, and now that you mention it, I realize lots of people there, they have a tongue scraper.
Yes. That makes perfect sense. The top of the tongue has all kinds of nooks and crannies where bacteria can hide. It's often a cause of bad breath if you don't get all that bacteria out. So yes, and you can purchase tongue scrapers here. They're very inexpensive. You can get them at any dental office or any pharmacy has them. It's basically a little plastic, and you just kind of run it toward the front, and you kind of rake all of the debris off the top of the tongue. Very much so.
All right. But a brush does a similar job like that.
It certainly does, yes.
Well, great. Thanks, Dr. Adami.
You're very welcome.